Hello, everyone, and welcome to the today's session brought to you by Apollo Fertility. The today's session, the topic is very interesting and something which everyone would need now. The session's topic is infertility counseling and support. And to speak on this interesting topic, we have Dr. Vijaya Geeta from JP Nagar. She is associated with Apollo IVF JP Nagar Center as a clinical counselor, as a head clinical counselor. She's a very senior person there. And to give a brief background about our speaker today, she has done a PhD in clinical health psychology. And her specialty is mainly behavioral endocrinology and reproduction, or in reproductive medicine. So we have Dr. Geeta here, Vijaya Geeta here, who would speak on this topic, which is something which everyone would want to know, that what are we supposed to do? What are the things that we should take care of? How do we keep our mindset positive during these while taking our sessions or while taking our IVF plans. So, ma'am, we are looking forward to hear from you. It's all yours. As and when any question comes in, I will put it in the private chat. Thank you, ma'am.
Welcome. Welcome, everyone. Back with another topic. It's infertility counseling and support. We all know a lot about infertility and a lot about counseling and also a lot about the support. But why is it's so unique that requires an attention or a session like this? Have you achieved what you wanted from a unprofessional or from a common person versus what happens when you approach a right person? So the session is like an enlightening one. Not only gives you a brief understanding about the roles, responsibilities, qualifications, trainings. Apart from that, what would you expect, or is it making your inability to ability to make your dream come true, which is your pregnancy? So welcome to this unique session with the same common terms, but how unique they are. I'm Dr. Vijay Geeta, a clinical health psychologist from Apollo CM Fertility, and being a counselor, therapist, and managing infertility. Uh, Giving into the nuggets, takeaways, and why would you look for a person is all the session all about. So happy journey. In this content, we will be looking into what are the psychosocial, social impacts of an infertility, what actually is an infertility counseling, and the role in the infertility counseling, what are the types of infertility counseling, and what are the professional qualifications and trainings and add-ons that the person would be undergoing to keep oneself updated and also addressing newer nuances. Welcome to the session. As I said, there's a lot about the psychosocial and the social impact in an infertility. Gone the days where a couple would try and nothing works up, and or there's history of miscarriages, or there is a medical factor, there is a proper indicator in the form of an ailment or disease to say that these are all the reasons why a couple or a woman is not able or unable to conceive and falls to the cadre of infertility. But today, there's a lot of people who will be walking and looking forward for not only infertility treatments but also fertility treatments. What actually would be a difference with that? Fertility treatments are for people who the fertility factors are all present, but they just don't match up. There's something irregular coming up, there is a hyperactive or there is an underactive hormones, there's hormonal imbalances, there's an after effect after that. But the goal to achieve a pregnancy is not happening. Well, the doctor would be playing the important role here to determine what can be done to achieve the pregnancy. Nothing much would be done. It's just constant monitoring and guidance, and then initially the couple would have a lot of frustration and a lot of hindrances from within to how do I open up. There's nothing wrong with me, so why am I coming here, would be one common question that would be running in the partner's head, because it's all the lady that's getting treated, monitored, taken care, pampered, medicated, whatever it is, it just comes on. But now for the infertility part, well, there is a proper treatment because there is a diagnosis and there is a regime, and the regime goes on. So not much, but on the whole, either it can be a fertility treatment or an infertility treatment. There is, to a certain extent, an impact in one's psyche, because not all are, one's own perception. It can also come from the society. It's like, you call the boss and say, I am late to office by 2 hours, can I need a permission? So the immediate question is why, what, where, how, what, and none. And he says, I have a doctor's visit. So out of concern comes, oh, is everything fine? If everything is okay, is something wrong with, probing questions and comes in. Is it wrong with your, family or members? They say, no, I have to visit my andrologist or my urologist for certain things. And then there's a lot of comprehending questions that comes. Oh, what went wrong? Oh, so, and then whereabouts and all the details, and then the little bits here and there, already started judging, like, okay, so already the person is having an issue or a problem, or it's been diagnosed, so there is a label that comes to the picture. So the stress from the social, from the social viewpoint, as even looking at one in a particular perspective, creates a lot of stress. And also it causes a lot of damage, not only to the self image of a person, it also damages the personality, the self-esteem and the sense of security, one's own question about how to move forward. Because the moment you say, let's do something, it will be complete job oriented, but the amount of question that comes from the other person is like, how sure are you sure, what are the indicators that you have looked into? So these constant questions is somewhere relates back to the unanswered question. How sure am I? What did the doctor say? What did doctor say correctly, or have I perceived it wrong? Or if everything is going correct, why am I not seeing a significant result? So because there are a lot of unanswered questions, and constant social, environmental conditions keeps on triggering them. What happens to such people is, usually we see that there is a confidence that gets shaken up, and then it also leads into a lot of life crisis, where with the immediate partner there is a lot of decision making, a lot of understanding, a lot of things gets hidden not consciously, but just don't want to take the brunt, or consciously hidden and show a false image. A lot of people tend to look into this cadre, because sitting from the perspective as a counselor, and what the kind of people who approach us, this common factor is nothing wrong with me. You try addressing my partner. She's always stressed, she's excited, there's a lot of anxiety associated, she doesn't eat, doesn't follow the medication, nothing is done, hence there is a problem in conceiving. And the biological parameters speak different. Though there is no direct impact by just becoming stressed, that this is directly affecting the pregnancy part, but indicators are stress. And then there's lot of gray areas, blind areas, or unattended areas that needs to be properly communicated and addressed, is all brushed under the carpet, and then pretend like there's nothing has happened, or that there's nothing wrong. A lot of crisis that a couple is put forth, and predominantly we see either of the partners or both the partners undergo the same. So this leads to a lot of painful psychological trauma, merely due to a few of the factors that has been identified here. Let's look a little bit, I'm not going to go into what your ART, or artificial reproduction technique, is all about, because there's a lot of information. I have also spoken a lot about that. Your doctors would give you a much better understanding, and the procedure is well evident in the open book. Whereas what would the technique would, the moment when doctor says, you as couple would be subjected for an ART. The moment such words is being uttered out through your family physician or your gynae or your infertility treating doctors, let's say the most experienced person and all that, it can be alarming and to a great extent traumatizing, because if it is going to be a repeated visit, or let's say for a second opinion or a third opinion, I'm still in a dilemma. I could not ask all these questions. Let me seek another opinion from another perspective. See, if you are completely open, completely discuss about the pros, cons, in and out about your fertility or fertility issues, I don't see that you need a secondary opinion at all. You would be much more being in the process along with your doctor, because the doctor is also facilitating you to achieve your dream come true. It's not a complete 100% work from only from the doctor side. It's a 50-50. So it's like a journey that everybody would pass through. Along with the journey is also your counselor, who would always constantly be behind, shadowing you, trying to make you understand if there is any gray area, looking into and is there any indications, contraindications. Are you, is everything going correctly with the injections part, the medicated part, the follow-ups, your scans? Okay, these are all the regular protocols that seems that all these, irrespective of what you feel, what you experience, what you whether you like it or dislike it, they are something that has to happen mandatory. So there's a lot of provoking issues that might come up the moment when an artificial reproduction technique is being advised, not necessarily directly as an IVF or ICSI, but also as an IUI, or as simple as, let's monitor your ovulation. As simple as that. This leads to a lot of emotional disturbances. It's like, okay, I feel this, so based on my feeling, my bodily symptoms, there is an expectation. Sometimes there is no feelings or bodily expectations, but certain things do happen. So there's a lot of confusion that happens within oneself, because understanding here plays a very important role. So there's a lot of emotional confusion that happens. To avoid falling into such prey is what the doctor would prominently look forward and plan and put you into a proper schemata, irrespective of what your thoughts and emotion is your body performing the functions, is these relevant markers are being done, have you reached particular milestones to move ahead. All this will be systematically taken care. So your emotions would be indirectly addressed. It's like a question, can I go ahead or not? Okay, there is an abdominal discomfort. Is it an ovulatory discomfort? Have I ovulated? There was no pain, but the scan says I've already, or it's been ruptured, the follicle is ruptured. So there's a lot of confusion. Rather than blindly thinking, it's better that you visit your doctor and finish it. So this leads to a lot of, the activities brings in a lot of emotional clarity, thinking clarity, because it's already been done, your body is already indicated and there is an evidence to say it's been done. So your emotions becomes much imbalance to balance, because your thoughts are much handled and analyzed. Oh, it's already been done. Okay, so let's keep this aside. So my second highlight is hurdle has been passed through. So what will be my third task to be achieved? So the framework is easily being followed, because in this process, not only your thoughts are well handled, but also the associated emotions are also pretty clear. So this also avoids a lot of hormonal imbalances where certain emotions are closely related. One of the important factor is the cultural view. Oh, isn't IVF or artificial reproduction technique is wrong? It's not been identified in our scripture text. What needs to be done? I'll hide and go and do. Am I sinning? No, you need to understand the difference between a fertility treatment and infertility treatment. Come to a clarity of what your cultural and religious support is all about, because I don't think so God would be standing in the way to say that these things are achievable, not achievable. If that is the case, rather than sitting and comprehending and scratching, you might as well get a clarity from your own cultural religious priest, and that's as simple as that. above all, no matter what says, it's one's own moral support. So the responsibility of the wife, the responsibility as a family person, the responsibility of taking a progeny to a next generation. So everything has a purpose and a reason, and there are supporting things to achieve those aims and goals. So moral of one's things are also being taken care among the reproduction part also. It's not something that's done unethically or immorally. So the ethical of the patient plays a very important role based on all the supporting factors. That also brings in a lot of clarity. Why are we talking about these delicate areas? Let's say a couple comes, their dream to come true, they take the advice of the doctor, and the doctor says, yes Amma, let's come day after tomorrow, we will scan and monitor to see whether you're ovulating, and facilitate for, let's say, a normal cycle or a natural cycle. Day after tomorrow is Friday. Oh, and every Friday there is fasting, there's a lot of puja in the house, and then I'm supposed to visit the temple. When am I going to visit the doctor for my scan? What to do? Okay, I will skip the Friday, I'll go on Saturday. One day, what happens is one common question. You might not know in the longer run how costly those 24 hours is. So you go the next day, doctor, yeah, you're supposed to visit me yesterday. Yeah, yesterday was my festival, so I couldn't make up. But you already knew that the festival is going to come. You did not, or it just doesn't strike in your mind, right? So the doctor scans and then says, I'm sorry to say that the ovulation has already taken place. You've crossed the window period, and chances of conception. The doctor would say it's not zero, but you can still try. So now what happens here is, despite your visits, due to something that comes in between, as lifestyle, the treatment per se gets obstructed. And this is very important why it comes to the picture, to also brief up, this time, this month, this day, these are all my inabilities, and what is the expectation out of the ART, the technique that would be given to us. So are you, ready to dedicate that time, allocated period? Are you going to follow a special regime of lifestyle in the form of diet, or are you allowed to do your cultural religious practices, despite will that affect this? So there's a lot of clarity that needs to come to the picture. Hence, the confusion is reduced, so your emotional imbalance is reduced. Thereby we are trying to reduce unnecessary hormonal imbalances. What are some of the common psychological and social stress that I could see among people who come up is a depression? Why? Whatever it is, whatever the parents, the in-laws, the friend circle, the society, social support would have tried everything, nothing would have worked. So as a couple, you are in a depression. What to do? We do not know. So that is where you seek an expert. Second question that will be running is, am I seeing the right doctor? Is because we're coming for the first time? Do we need to see the other doctor? Because deciding where to get treated, under who to get treated, am I in the right hands, is one small question or doubt that every person will have. But nothing is going to stop you in visiting once, having a communication with the treating consultant. That, rather than sitting and comprehending, is as simple as coming and getting it, to have a glimpse or view, to hear what the expert says all about. So that helps you to come out of a lot of depression part. Second part is anxiety. Why? The very first thing that anybody would write on a consultation paper is anxious to conceive. But how anxious you are, what are the factors that makes you anxious? Have you discussed that? I don't think so. So it just kept piling and piling and piling and piling. I went, we said this thing of our inabilities, what we did, how we did. The doctor gave us a series of blood tests and monitoring scans, and then don't know what to do. It is never like that. So how conveniently you interact and how much of information is being expressed is all the clarity that you get to benefit out of and advised treatment. The most common doubt that any couple would have is will it lead to a sexual dysfunction, or is there a sexual dysfunction hidden among between the couple, which is what is also being identified. Is that one of the reasons for not conception, or will will the couple will be leading to this sexual dysfunction out of the treatment? So there's a lot of questions or myths associated around sexual dysfunction which can be addressed by the doctor. Damage to self-esteem. So there can be, not overnight a couple, the self-esteem would have been affected because, continuously going and meeting, and when things don't work out, and then they say, see, you need to go meet an expertise. My level of things are done, but we've not seen a fruitful result. This is also common, provided if you do see a senior most consultant and you try to get your opinions. This all would be addressed if you have decided where, under who you will all get treated. So difficulties in interpersonal relationships, this becomes pretty common. Do I need to say this point, or shouldn't I say this point? Do I need to discuss this with my partner? Should I keep it to myself? I would like to discuss with the doctor, but not with my partner. I would like to come to an idea. There's a lot of questions would be there, right? So this is where the psychologist or the counselor would be facilitating something called, after the consultation, a series of counseling sessions, which is also provided for such couple. And what are the sessions? What are the types of sessions? You will come to know in the later part. What are the some of the implications, the specifically detrimental implications in infertility? So these points are actually taken from the British Infertility Counselling Association journal. So according to the journal, or what actually the documentation says, which would have covered quite a few thousands of cases, is what is one's relationship specifically between the couple, that is either the wife or the husband, and among the relatives and the friends. So one would try to understand the relationship bond. This facilitates a lot in, specifically when a treatment is advised. So do you want to divulge the treatment to the partner, or do you want to keep it for yourself? It's absolutely fine to not to divulge, but things are taken care. See, as long as the couple's goal is met now to become parents, I don't think so. It is, if the self-esteem is getting hurt, but if the medical part is taken care and the treatments are going fine, I don't think so that in any rare causes that the partner would keep on intruding into the other partner's treatment line. So mainly the relationship here plays a very important role. Such personalities also, sometimes it reflects that they are very hard to deal with other people. So in the one inability of one part of life reflects in all part of life. Oh, I don't know why he started becoming rigidity in addressing certain things. Gradually that same behavior starts getting reflected in other parts of life. So becoming difficult to deal by other people. And some of the important factors is announcing a pregnancy. How will I announce my pregnancy? What will I say? I'm not comfortable telling that it is conceived out of an IVF. Not necessary. Who's asking the details? So it is up to you how much you share, what information you want to share. It is not like anybody will come to know what sort of treatment you are going in. Gone the days where couple would not step into an infertility clinic. It has taken at least a decade for people to understand that it is not wrong to step into an infertility clinic, or all who step into an infertility clinic are infertile. So to break that myth, it's almost a decade now, and these are personally my own experiences being counseling for the past 10 years. So announcing a pregnancy can be as simple as congratulations, and nobody is going to probe into asking how did you get pregnant, because that's something confidential. And you need not be scared that tomorrow somebody else will walk into the clinic and ask, my known relative is coming here, I would like to know what is she getting treated for. You will not get a speck or a hinge or a mustard seed information about any other couple's information. So confidentiality is well maintained, so you can avoid the fear factor, what if things get out of hands. So confidentiality is maintained. Having a baby or not, why certain times that um, the the point of certain curiosity arises, can we try now? No, I am visiting the daughter so that my fertility parameters are all well intact, so that tomorrow or in later part of life when we are planning for pregnancy, I do not want any other parameters coming to the picture. Good. Planning to have a baby is also possible, so visiting the consultant is the one of the answers, is the first step. By just people, by just seeing people enjoying family life, one would feel the closeness or the importance of getting into parenthood. Women report significantly greater infertility related anxieties than men. This was also one of the important factors that see that men more vocal or women more vocal. And most common factors, yeah, it's only the lady who comes, it's only the lady who asks, it's only the lady who asks why, and very specifically, why me? And probably it is the women who need to bear the pregnancy. But it would be nice if men also take the responsibility of asking why. Is there a reason why? Is there a male factor? If so, what needs to be done? If not, what would be the role played to support my wife will also come to the picture. Overall, if you see, life satisfaction is one of the important parameters that is always associated with such fertility treatment. Sexuality, though not abruptly said, is also being subtly met, because everybody is equally curious, or subtly keeps a point that in future there is no contraindications. Are there no any side effects after an IVF treatment? Will my partner be healthy and fine after my pregnancy treatment? Is one question that comes to the picture, and they're also well addressed. The self-esteem plays an important role, because in most of the cases, if the partners, or if both people are not giving us the right information, or not divulging, or withholding information in the name of, I don't think so this information needs to be divulged, all that is required is a treatment. No, you ask the doctor, let the doctor tell the treatment, and you get treatment. Sometimes, or most of the times, never works. So self-esteem plays a very important role. Not to take things too much or too seriously unless or until the reports are in a very bad condition. Avoidance of friends, one of the important behavior that has come across among such people is they start isolating from others. Okay, I have to go every day to the doctor, and every day 1 hour if I'm absconding, my office people will come to know where I am going. I might as well not tell, no. Or I might as well not be friends, so that they might not question me such crucial questions. Why are you late every month for in this particular time? Because there is a fear factor that comes, that what if others come to know? So one needs to overcome that, for which not every person is going to be very curious or probing, but there's a better way of mingling with people, dealing with the family, dealing with the society. What are some of the management that would be given or managed during the treatment, through the counseling sessions, or through a form of psychotherapies, and something that would address the mental issues, is the elevated anxiety. Common factors, and the first and most prominent or the important factors is the anxiety that comes. Doctor, after this will it get done? After this will I get pregnant? What if I don't get pregnant? Why doctor is telling there is only 50-50 chances? Why there is no, why that doctor told me 100% chance? Why is this doctor telling 50-50 chance? There's always anxiety associated. And to a woman, every step, okay, I have taken this medicine, will it take me or help me achieve my dream come true? Lot of anxiety. So when there is lot of clarity and understanding when it comes with the treatment that is being provided, then in such cases your anxiety is reduced. In this case, what for an unsuccessful treatment, what is it that can be expected? So our first counseling would be that what to expect out of the treatment. So though the factor counseling comes to the picture to be it's one line, counseling, the way, the pattern, the perspectives, the case history, the history of the cases, everything matters, and what to expect out of the treatment is also clearly told. Thereby, let's say for some wrong idea, the couple would have had a factor like, oh, okay, my history of failures is already told me that doctor has advised me to look into the donor gametes. So there is an unsaid sadness that, okay, because of my certain parameters, this doctor advised me a donor gamete, and I think that's the end of my life, and something that brings in sadness. When you go for other opinions, or you take, if there is asking, is there a treating window to see for a cell cycle, if all those probing comes to the picture, and let's say there are windows that comes up out of the counseling sessions, such sadness can be well addressed. Negative emotions that gets generated out of failed treatment, or treatment that is not being started, something comes in between treatment and it is all gone wrong, can also be handled, because a couple is well educated, well informed, as well as well explained every step, every day, every journey of explanation, why this, what is the value, what does it indicate, where is the couple heading towards. A lot of anxiety, depression and distress surrounding the blind journey is well taken care. So we manage a lot by giving information, because these becomes a subjective. The treatment line would be the same, but what one experiences, oh, today morning one of the patients said, ma'am, I did have lot of headache. The other patient says, ma'am, I'm not getting sleep. Both are in the same treatment regime, but the experiences or the psychological experiences indicated as physical pain or lack of sleep does show, though it is anxiety, but it gives through different symptoms. So, how do you manage with a psychotherapy, or do they really need a therapy to handle, or it is something with a simple explanation that can be given? What is the advice that you give them? Is that advice really relevant for that particular person? All will come to the picture, through which next day when the lady comes back, we would see that her anxiety is much elevated, the depression is reduced, and she is stress free. What are the emotional impact of infertility? Mostly couple would see that most of the questions are, as I said, brushed under the carpet, behave that nothing has happened, or negate and push it out to say, oh, is that so? So there is a lot of negligence, or things that are neglected will again resurface. Okay, despite of doing all this, everything is a failure. My ultimate goal of conceiving has not gone. So are there factors that are neglected, turns out to be costly, turns out to be you need to address them? Well, then the impact in the infertility is pretty high. First, one needs to understand whether it is a physiological factor or the psychological factors that arises or causes this emotional disturbances. If there is a physiological factors, we will look into the biological part, or is it because of the medical or the medicine part. If it is more psychological, we would probe into to see whether it is a simple thought process and emotions which is arising due to the elevated hormones, or does it really have an undermined psychiatric issues. So a lot of probably to say a second stage of counseling, by that time it would go into starting addressing to lot of emotional factors, segregating and moving ahead. Despite of doing all this, now the curiosity comes, ma'am, what actually happens in an infertility counseling? What is counseling is all about? Counseling is a session where a psychologist explains elaborately the advised infertility treatment, how it would disturb the lifestyle, how would disturb the health, how it would go ahead, what are things that can be expected, what are the psychological things that would also get upset about, to give you in a package throughout your treatment. This is your treatment, your duration, what to expect, what not to expect. First set of discussion is actually nothing but a counseling. So it is one who is professional, who is assisting to the couple who is seeking to overcome their problem. And it is definitely a professional process because the steps or the nuances and the advice that is given is all scientifically modulated one, and it is always informed by a body of theoretical knowledge. So as counselors, we are trained to counsel in a format. So what needs to be done when a couples come to a cabin? What would be step 1, step 2, step 3? So it goes on. Following proper ethical codes and moral codes and values is the first and predominant thing that any counselor would have been well trained. So the first discussion, even before getting into the treatment line, is asking whether you're comfortable, or is there any inconvenience or disturbance. Are you ready to go ahead with such a treatment? Are there any doubts? Is it okay? So looking into the value system as well as the ethics in the couple is the first and foremost thing. Above all, being empathetic in addressing all the questions that comes to the picture, which is nothing but to over or less giving additional information or properly making the information well understood. The bottommost line or the moral or the result of the counseling session is not seeking for an answer. It's not the counselor who will try to get an answer yes from the couple's mouth. Together, put together with all the information that's provided, with the doubts cleared, with ethics and morals well understood, what is up to the couple, that decision making as it will enhance it. So that is the role of a psychologist or a counselor. So in the from the counseling viewpoint, we provide a lot of information or doubt clarification. From the psychologist viewpoint, we also do but certain things of understanding the personality, understanding the background, understanding the religious cultural view, understanding the lifestyle, understanding the work. As of now, these are a few that engulfs any couple. Would come to a better study. Probably this question or this doubt is arising due to the environmental factor. This inability is coming due to traveling distance factor. So a couple is well handled if the couple is deciding to go ahead or looking forward to any better treatment advice. So what actually would you look for? So when you meet your counselor, she would be in a very personalized space, a space which doesn't have any hindrances or recordings or disturbances. A counselor who's pretty qualified, you have to question your counselor on her qualification and experience, and how many cases handled, and if at all anything that you would question. So not all people will know about all religious, psychological, cultural factors, but a gentle question would always look into. Whatever has been discussed with the counselor remains confidential. So that confidentiality, you need to check whether it is well maintained. And also, the session is all about to explore the difficulty in distressing, or this still stress is there. So when if a psychologist or the counselor addresses that, it is a session to understand, and thereby what are the areas of dissatisfaction in life also comes to the picture. If the entire outcome is to increase the ability in the person to make better choices. Can this incorporation bring in a better change? Can these looking into various aspects of the situation, will this person overcome all that and achieve the dream come true? So the session is all about handling the people or the couple itself. So the session initially will be couple. Gradually it will be, you will be meeting one at a time. So there will be, couple therapy if required. There will also be individual therapy to understand the personality so that it is better communicated. Is there any aspects that needs to be dealt for a female to one level, to a male the other? Is there the role of immediate family members that needs to be addressed? So there's also family counseling that can be done. So in the beginning, the most important steps that the counselor would do into is a couple counseling, individual counseling, as well as a family counseling. So patients have relied preliminarily on their partner, that is spouse, family, whenever there is a distress. So where do you want go when you are upset or you are stressed, or you do not know what the answer is? If it was education, you would have gone back to your professor. If it was your friends, you would have gone back to the friend to ask what is it that is missing. Or if it was a family issue, you would have always seek the help from the parents or the seniors like your grandparents and so forth. But this is something new, because your parents or grandparents wouldn't have experienced what an infertility or even a fertility treatment is all about. So forget about getting or seeking the right answer. Usually the guidance would be, don't know, let's look into it, probe into it, and see how it can be done. So addressing everybody's doubt becomes mandatory. So rather than blindly speaking with someone who doesn't even know what is it, how come that kind of a person would give you a support? So the distressed people become more distressed because the people fail to understand what actually the couple is undergoing, and also not knowing how to do so. Some random explanation will lead or only complicate the implications. And anyways, the goal and the course of the treatment are not meeting together, and one of the starting point of the confusion also comes to the picture. So yeah, infertility counseling basically starts being a part of the program before your treatment, during your infertility treatment, as well as after the procedures. Before the treatment, predominantly it will be about doubts about the treatment advice, how to go about that, what are the lifestyle changes, what are the inculcating new habits that needs to be done, habits or patterns or lifestyle that needs to be modified based on the blood test values. All that will come to the picture. During your IVF treatment, are you following the treatment correctly? Are the parameters that is which are the nuances towards the treatment are well taken care? Are relevant things done on time basis? Because most of the treatment here is on hormones, and hence time is a very important factor. So your time management plays a very important role. So individuals and couples who are like, no, I have to come from another part of the city, I need to plan accordingly, all needs to be taken care. Post your treatment, what can be expected? Oh, treatment is done. Next, what? How to go about? What will the doctor say? Even before meeting the doctor, there will be thousand and one doubts, right? So all that would be addressed in the counseling session. Always to remember that the counselor is not involving in the decision making of the couple or the individual. They try to elicit out, are you clear? Is there something that needs to be asked? Do you want to ask but you do not feel like asking? So it is only that bringing into awareness that everything is still existing or nothing is existing as long as there is no lack of clarity or clarity within the person. Infertile couples, for such counseling is always expected to come, mainly because in a session the couple needs to be addressed, both husband and wife. Such sessions becomes fruitless when either one or none of the person is showing interest. It also shows that there is a disharmony between the couple or the family members. So coming together, because together there's a lot of decision that gets affected, which also which becomes a part and parcel of your investment and the treatment process. The informed consent plays a very important role in deciding then and there. So to go ahead with any treatment that is advised, it's not usually the common behavior, yes ma'am, yes doctor, let's go ahead, is never the case. So consents, what is the treatment, what will be going through, will all come to the picture. If required, there's also something called fertility group, where similar treating couple who like, I would also like to know what some other person who's being treated is experiencing. I know as a counselor, the experience is being shared without knowing the patient's details, but I actually wanted to talk. So rather than sitting in and asking your partner who's sitting next to the gun, hi, how are you? It's like probing in or barging into the privacy. You can always look for any fertility support group to check. Okay, is it just my own doubts or even everybody has the same doubts? So that session is also available. Always understand the purpose of this infertility counseling is to explore. It's purely to explore the thoughts, one's feelings, beliefs, and relationship. Why? So that whatever is the treatment advice, leads to its fruitful action. So the support has to go hand in hand, because in this support we are accommodating the thoughts, the emotions, the feelings towards any treatment outcome. Why? The treatment outcome is not a well decisive one. It's like a fracture and then your bone is set, and what this bone set is done happening. No, it is not like that. Since it's always a 50-50 process, like if there is an implantation, we say 100% successful, congratulations, you are a mother to be. When the implantation is a failure, when we say sorry madam, sorry to say that the pregnancy report turns to be negative, how would you take it? I knew I had so many doubts. So rather than falling into such depressive, aberrations of wrong thoughts, one should always be in a platform when all these doubts and beliefs and thoughts are well handled, to have a good treatment platform which is non-judgmental. The framework is just not treatment but also empathetic in engulfing as a whole the person who comes. And it's always being encouraged from the patient's view also to seek their own solution. Okay, are you willing to go ahead, or are you mentally prepared? What is it actually that you're expecting? So it's an inclusive journey to be more about. So counseling offers support to manage the distress on all levels. It can be pre-treatment, during the treatment, also the post-treatment. Therapeutic processes and therapeutic support is also available based on the issues and problems. And here, the counselor is usually an arbiter of an ethical behavior. So, nowhere there will be like, madam, you tell, no, what am I supposed to do? No. We are not here to give you answers. We are here to facilitate you. So, understand that. Now comes, ma'am, you said there is a pre-counseling, during the treatment counseling, post-counseling. There's also psychotherapy treatments that would be provided. I would like to know in brief, what are they? Usually, every counseling goes hand in hand along with any visit. So first type of counseling will be just information counseling. Your confusion can arise as simple as due to lack of information. Second type of counseling is implication counseling. Ma'am, I'm undergoing this. What can be the pros, cons? What can I expect out of this? Will this happen? Where you can face, or what I can expect out of that. The third is a supporting counseling. There are areas, ma'am, I've taken injection. When will I see a significant growth? You need to wait for 24 to 48 hours. But until that 48 hours, you just need a support to say everything will go on well. This is just a blind phase journey. Henceforth. So the third kind of a counseling is a supporting counseling. Fourth is a post-therapeutic counseling. After the treatment, what can be done? Why are my symptoms not coming down? Why the elevated hormones is not dying down? Is it same? Where are other ladies also experiencing the same thing? All comes to the picture. So before getting into in detail what they are, let's look at some of the questions. So the first question is, as a couple who have been advised for IVF technique, they face the issue of how to inform the same to the immediate family. To my understanding, how would you speak to your family members if you find a hindrance? It is best that you bring them to a counselor. So the counselor will make the family member understand that there's nothing wrong. There is a treatment that would support to help your family members to achieve the dream of pregnancy, motherhood, be fruitful. So, what would be the hindrances? What would the doubts arise? And also this becomes a window to take a in-depth case history about what were the parents undergoing during their pregnancy time also gets highlighted. So it is, if you do not know how to say, you can bring them to the hospital or to the counselor. Many a time, due to the inability of conceiving, the couple starts blaming each other, sourcing the relationship. So in such a scenario, do you suggest that they should first manage the conflict between them before starting the cycle? If it is very evident that it is just this infertility treatment that ticks the partner's emotion, then you need to address that. You need a professional person to intervene. If that just a part and parcel, because for my partner, something that if I don't cook will tick, something if I don't do properly will tick, then it is interpersonal. So that you need to sort it out to yourself. The psychologist of any treatment background will always see that interpersonal, intrapersonal, on the whole, the first limitation would be it should not affect the treatment that is ongoing or planned to be taken up. Because not every couple will be so open to talk about their journey of love and marriage and history and inability. So it is a limited window, right? So we are not dealing the person from time begin to end. So in that limited window, the counselor would just play the role of providing the support so that the outcome of treatment becomes much more beneficial. So in that case, if you see, it is a limited support, but it is what that you can expect. So in the information counseling, one would get all the information that is required. First hand of information comes from the doctor, because it would be the doctor who would be advising what would be the nature of the treatment, why it is advised. Second kind of information, you can advise it from the psychologist, because certain jargons, technologies, therapies, treatment, you might not understand. Why blood test again and again? Why blood test only on this day? Why my injections is only in a particular time? What if I skip injection one day? All the pros and cons, your doubts can be addressed by the counselor, because she will put forward the importance of medication, monitoring, test, and so forth. What would be the outcome of that? It helps a couple in good decision making. You understand the treatment and what the treatment would mean to them personally, or is it affecting them to what level? Can you address the emotional trauma or the psychological trauma by giving an advice or a therapy? Why is it recommended? Specifically when it is infertility that is being addressed, and when doctor talks about donor programs and surrogacy programs, or my family is complete, can I donate my embryos? What would be the repercussions of that? What are the legal implications? What would be the ethical issues? All that can be addressed and understood well ahead from the implications of such counselings. What kind of a support that you get? Mostly, the support of emotional distress and overcoming problems, the blind walking through the treatment journey and your experiences. Everyday injections is not something that everybody would experience. The distress, it will be useful to rightly diagnose an fertility problem. Did you tell everything to the doctor, and then the couple after discussing with the counselor, like, I forgot to tell this. So sometimes you become, you will have a shoulder to discuss, and while you engage in the discussion, certain other matters would come which would be relevant and would carry of medical importance, which when you discuss with friends or parents, they might not know that, oh, this doubts is arising because of a factor. This is important and this needs to be discussed with the doctor. Parents or your friends might not say, but this is where the counselor or the therapist would say. What to do when you're expecting your results and your results is like 15 days long? What do you do? What can be done? How to kill the time productively? Your online or offline support. Sometimes you need not visit the counselor every day. You can give a call, or you can do a chat, or you can have time allocated. Madam, can we have a 10-15 minutes? I want to de-stress. So these are all the some of the supports that you can expect out of Okay. Sorry, something went wrong. So, getting ahead with the where we left, some of the support counseling that goes on here. Post therapeutic. So, after the treatment, how do you cope? What are the inabilities that you would be facing? What can be planned for the next treatment? How do you minimize the existing stress? And how do you maximize your problem solving? Do I need to take a treatment immediately? Can I give a break? How long is the break? So, all about the discussion on lifestyles and productive measures. If something is lacking in your blood parameters or hormonal parameters, can you get treated? So all the medical part is well segregated, and also the psychological part. So when we give therapeutic sessions, we also use related questionnaires, which is already well framed from the academics, that we use to gauge the patient. What is the personality of this? Okay, with such person, I cannot directly, give an answer to the coping mechanism. So, based on personality, sometimes a person would prefer in one way, disclosing things to certain personality, it will not happen. So, understanding the personality and understanding the psychosocial aspects of the person will help us I can see myself.
Ma'am, I can see you can start now.
Sorry, reappeared. Am I good to go?
Yeah, good to go.
Yeah. Is the PPT visible? Yes. So, what would be the services included? I'll reiterate back. One is, no, the counselor would provide the medical aspects based on your infertility or fertility parameters. They will make you understand your basic reproduction, based on your body, your limitation, what to be expected. The diagnosis and treatments in an infertility problem, which is advised to you, the etiology of both male and female parameters, and respected ART procedures, artificial reproductive procedures that would be given. What would be your psychosocial aspects in infertility? You would be getting to know more about your uh, external hindrances, your marital and family issues. Will there be an impact in your sexual functioning? The various approaches of various assessments that can come to the picture. The response is either it can be typical or atypical. What are the alternatives that can be coming or advised in case if the infertility advice is a donor or a surrogacy programs? What would be the legal and ethical issues in any infertility treatment that is advised? All these are something that you can expect from your counselor. So as counselor, we play a role of bridging between the doubts, clarification, and facilitating for a better decision making towards making your dreams come true. So, what is the treatment provided to you? I know the counselor would facilitate to make it to a smooth journey. Still, there would be boundaries because every counselor would be working based on their rules and laws and regularities based on the hospital setup. It is a complete professional engagement, abiding the laws and standards of infertility. In conclusion, what I would like to say is we brief about infertility so you will understand your own body's um, role in fertility or infertility treatment advised, because it is highly subjective. Though the treatment might sound the same, I underwent IVF, she underwent IVF, he underwent IVF, but the nuances of the procedures, what actually within that has undergone, is subjective. So where one stands in infertility is a subjective explanation, and the doubts are unique, the lifestyles are unique, what is expected for the advised treatment is also unique. The associated distress and range of implications, family issues, social issues, work issues, everything gets addressed. Thereby your emotions, which you feel, oh, all this would be neglected, avoided, is all negated, so that you will have a happy journey, because there's always a lot of hormonal imbalances and always a lot of questions, to have a stress free and a fruitful journey. Infertility counseling is all about this, which occupies a lot of assessments. We also do a lot of assessments. We help in facilitating the person to have a comfortable journey. Why is the word journey used? It's not one day event. It's not you came today and your pregnancy is tomorrow. It's not you come today and tomorrow is your IVF procedure. So you will be repeatedly, visiting the doctor. There can be some other treatments or some other test. One will lead to another. There might be some chain reactions, after reactions. When would this come to an end, or why is it advised? There's some hanging doubts, something that crops up, something that's not available in a regular genre to search and find an answer. Your counselor is a better person because she would have already known about your, this is how you think, you feel, this is you. So based on your personality, your problems, your social ethical way of living, so these can all be the hindrances which can be predicted, and then the entire journey goes smooth. A smoother journey is much better than a confused journey. So it is actually a combination of a medical health as well as a mental health. So medical, psychological aspects are integrated in an infertility setup, and it has always led to better outcome. Outcome can be anything, but how do you take it forward is all that matters. So that in light, I would like to thank everybody for the peaceful listening. And if there is anything, you can always get back to this number, and I'm ready to speak to clarify your doubts. And let's speak. Thank you for listening.
Thank you, ma'am. Thank you for the wonderful session. Thanks
Thank
so
you.
much.
Yeah.